Rodman with Sports Chiropractic. We have a lot of people that come in and they have pain into their maybe shoulder, elbow, arm, or hand, and sometimes it's actually not coming from this area. So today we want to show you a test that you could do at home to actually see if your pain is really coming from the arm or if maybe it's coming from a nerve that's actually pinched in the neck or in this area. So is it nerve pain or is it really arm type muscle pain injury? So just to show you the anatomy first here, we're going to point in a little bit closer there. We have those nerves that you can see coming out of the neck right in this area, and that is what we call the brachial plexus. And these nerves, as you can see, they start at the spine here, but as we back out a little bit, you can see they actually go into that shoulder all the way down into the arm, all the way down into the fingers. So that's why if you have a problem up here, it might actually cause pain, wherever that's going. Nerves are very sensitive. They don't like to be stretched too much. They don't like to be compressed too much. So when they're compressed maybe from a disc in the neck or the joint pushing on it, or sometimes a muscle in the arm, it's gonna cause pain, weakness, numbness, or tingling throughout that whole entire arm. So the first test that you can do at home to differentiate that is you're basically just gonna take your hand like this, you're gonna bring it back all the way and stretch that, and then you're going to tilt your head. So this is stretching the median nerve. And if you have a very heightened, severe increase in your symptoms, if it gets really painful when you do that, more than just a stretch, that's a positive sign of possibly a median nerve injury, maybe coming from a problem in the neck or maybe a pinched nerve in the arm or shoulder, hand area. The next test is you're going to take your thumb, you're going to grab it, pull it down, rotate it in, go back as far as it can go, and then tilt the head again. And now you're stretching the radial nerve. So same thing, if that increases your symptoms, that's a positive sign of a radial nerve injury. And the last one's kind of funny, probably haven't done this since you were a kid, but you're gonna basically make glasses like this. And this is actually a real test for your ulnar nerve. This is stretching the ulnar nerve right here. And same thing, if you have an increase in the symptomatology with that, that's a positive sign of ulnar nerve ulnar neuropathy, ulnar nerve pain, or maybe a compressed issue somewhere in the neck, shoulder, or arm. So basically, try those tests at home if you're having arm pain, see where it's coming from. At Sports Chiropractic, what we can do is we can give you a specific, pinpoint, concise diagnosis of where the problem's coming from and what we can do to eliminate it. We do a lot of muscle work here, so we can actually sometimes try to peel the muscle in a way off the nerve to floss the nerve through. Sometimes muscles and nerves get stuck on top of each other and they get adhesions. So we actually find that precise point and we're trying to get that nerve to slide freely through that muscle so it's not pinched anymore. And that's something that we actually specialize in here at Sports Chiropractic. So if you're looking for a very precise diagnosis, looking for relief from your pain in your shoulder, neck area, we can definitely help you out. Hope that opens up your eyes as to nerve pain versus maybe a muscle type injury in the upper extremity. Dr. Rodman, have a great day.